You're listening to The Health of Business, where we talk openly and honestly about what it takes to run a healthcare clinic business in BC and Canada today. I'm Danielle Boyd, and I'm glad you're here. Welcome to The Health of Business. This week's guest is none other than the CEO of the Physiotherapy Association of British Columbia, Andrea Burton. Andrea has been an incredible leader in the organization for the last 2 years, and beyond her experience within government and different health organizations, Andrea is just a really incredible person who cares deeply about the profession, and the advocacy work that she and her team over at PABC have been doing over the last 2 years has been none other than massively incredible. It's advanced the profession in ways that, has been much faster and much more efficient than anything I've seen in my career. In this episode, you can expect to get a little bit of an update on some of the major items that PABC has been working on, things like the Pacific Blue Cross issue, ICBC terms and conditions, where they're heading with the WorkSafe directives, MSP, fees, and most importantly, our new HPOA, Health Professions Occupations Act. This is a doozy. This is a really big piece of legislation. And Andrea and I both really want to emphasize the importance that this carries for the professions, especially physiotherapists, all healthcare practitioners across the province. But if you haven't already, I would strongly encourage you to start digging into this piece of legislation that will be enacted on April 1st. It's got a lot of really heavy hitting stuff in there. So definitely take a look at that. Lastly, PABC renewals are up for September 30th. I'm releasing this episode a little bit earlier than I typically would. I like to go every other week, but we're getting this one out there ASAP, because if you're not a member, please join. The work PABC is doing is incredible, like I said. So, if this episode doesn't convince you, then I don't know what will. But if I could get one message out, around this particular conversation, it is that being a member is working. We're seeing huge wins, huge advancements, and I would really strongly encourage you to become a member if you aren't already. And if you are, fantastic, renew before September 30th. And without further ado, please welcome Andrea Burton to the Health of Business podcast. Andrea, thank you. Thank you for being here. It's actually an honor to have you on the pod. So I'm very grateful for you to take the time and do this. And
I'm super happy to be here. I love working with physiotherapists. So
physios are like, not to toot our own horn, but there's some pretty cool physios out there. So I like hearing that. That's really fun. Actually, I'm kind of curious. Like, you've been here now, what, 2-ish years?
Not quite 2.
Not quite 2. I'm kind of curious, like, what is sort of your assessment of physiotherapists as like people? Like, what's your assessment of the people in the profession? I mean, obviously I'm biased, but you've worked with different entities, so I'm kind of curious.
Yeah. So, physiotherapy is in an interesting position when you sort of think about how the healthcare system hierarchy works. And if someone tells you there isn't one, you can all laugh out loud, because we all know that's a ridiculous statement. So I always talk about the big 3, which really is doctors, nurses, and pharmacists. I would include dentists in that, except they're in such a different part of the healthcare system that it's sort of a weird intersection there. But so there's the big 3. And then if you read my blog this past week, then there's all of allied health, which is what the government calls it. And that's about 70 professions that are all shoved together. So out of that group of 70, physiotherapy is really number 4. And I think even government would say that. And I'm like, okay, well, we need to be like the big 4 as opposed to the big 3. So there's something I think is sort of one of the sort of things I look at as a potential goal for the future, is how do we actually change that conversation? And I think physiotherapists are mostly ready for that. Physiotherapies are many of them. Well, I guess I wouldn't say many of them, because I don't want to talk about them as individuals, but as a group, not unlike other allied health professions, they haven't always felt empowered to speak out and to push back. And so I think that's one of the things I've noticed most, is a little bit of surprise from the profession when I say I don't like something, and then I don't just cave in and give into it, but I'm like, no, I don't like it, and you're going to fix it. So I think that's been interesting to recognize that there's a certain amount of conflict aversion amongst the profession. And that's because I think a lot of the allied professions have really gotten used to just sort of maybe saying, I don't like that ICBC, but then, okay, well, never mind. You're not going to fix it anyway. So I think that there's lots of room for physiotherapists to be stronger advocates for themselves. It came from dental hygiene, and I was there at the beginning of the pandemic. And almost all professions in BC raised their fees during the pandemic because they were paying for more PPE, and there was the protective glass and changing the reception area and having people have to go outside to greet patients. But physiotherapists really did it. And so, unfortunately, when you don't change fees for 10 years, you end up so far behind the eight ball, right? So there's a little bit of bravery. I always think about that Sarah Bareilles song, that "Show Me How Big Your Brave Is." And I'm like, that's kind of what we need physios to start doing, is to really show me how big your brave is.
Yeah, I agree. And I actually feel like you and Sean and the team at PABC over the last couple of years have really instilled more of that in the profession. Like I really, having been a physio for it's actually the 11th anniversary. It's been 11 years now, so going into year 12,
Congratulations.
which thinks I feel like I just graduated. I'm a baby. I'm not, what? How did that happen? But like having known people in the profession for a long time, I agree. Like physios tend to be pretty like nonchalant, like, yeah, it's fine type people. And, I think that's a great characteristic in terms of just like, personality, but it doesn't attribute to or contribute to like moving the profession forward and fighting against the big players and, getting what we need in terms of that. And you're absolutely right. Like, I think that is something that if I had a message for physios is it would be along that line of like, yeah, let's be braver. Let's push back where we are getting bullied and like, let's show that we are actually really contributing to some amazing stuff in the healthcare community. So yeah, I
I
agree with
say
that.
let's stop having things happen to physiotherapy and start making things happen for physiotherapy. There's a
Yes.
big difference just in that.
100%. Instead of being reactive, let's be proactive.
Yeah.
And I do see that shift happening. Like it seemed like, I mean, you obviously walked into PABC and then within the first month of being there, walked like ended up in this complete storm of Pacific Blue Cross.
Yeah, it's an interesting
And
start.
right, that was a welcome. Here's a huge plate full of, you know, storm to deal with. But in the end, I think that was very reactive on the part of the profession. But now we have shifted. Now we're proactively looking at, HPOA and WorkSafe, and we'll get into all of those things. But there was a couple things that were reactive. And I really feel like your team has initiated this kind of shift into proactivity versus reactivity, which is something that like, we always just kind of did things the way they were because that's how they are in the profession. And, when things happen, we just adapt and like whatever. But it hasn't really been working. And like you said, we haven't increased our rates, in terms of, like we've had our custom like inflationary rates over the last 10 years. So, but in fact, I found many physios were actually decreasing their rates over COVID because they were offering telehealth instead of in person. So even though they still had all this overhead, they actually decreased their rates because they're like, oh, I'm not, doing things hands on, or I'm not, the overhead isn't as much because I'm on my computer. But they were still delivering the value and the education and the knowledge that they had acquired through that, right? Like pricing ourselves in a way that is like, for this thing that has this like amount of value attached to it per hour versus like paying for the experience and the knowledge and, just the ability to guide someone, and the end result is a very, very different thing. And I think physios maybe need to shift into that a bit more.
There is a confidence piece that isn't necessarily there for a lot of physios, which, like, it's funny because so many of the professions that we work with, or if I'm working with a government relations person, or I'm working with someone who's, a lawyer, for example, it doesn't even occur to them to undersell themselves. You're paying for their experience and their wisdom, whether you ever sit down across the desk with them or not. And we need to value ourselves that way. Physiotherapists need to think about, okay, how much time and education have I put into my career? How much work have I put into every day working in a clinic and learning best practices and learning how to work with people? How much time have I put into helping patients and coaching them through to those difficult conversations? All of those things are what you're paying for when you see physio. And so
Yes.
that's the piece that physios need to realize. You're not just talking about, I can move your arm this way, I can move your ankle this way. That's actually a very small part of the patient experience.
100%. Yeah, you summarized it perfectly there. I think that's, like, a really great way, like, you are paying for the expertise and wisdom that someone has gained through, years and years of training and education and trial and error and all the investment, time, money, energy-wise that the physio has put into their now package that they're giving you in this X amount of time.
And I love that most physiotherapists are very invested in keeping up to date with trends, with research, with knowledge, with evidence. I find that is very refreshing about this profession. It's not necessarily a slam on the professions where I worked before, but being that master's prepared level is a different thought process for people who are physiotherapists because they are thinking, what are the best practices? What do I need to know? What do I need to learn? What articles should I read? And I love that about physios, that that's actually an important part of ongoing learning and development. It's great.
100%, and it's unheard of to, like, talk to a physio who hasn't taken some form of
Yeah.
continuing ed, they're going and taking needling, they're taking muscle testing, like, physios are always doing some sort of coursework, year
Yeah.
in, year out, so I agree, and I think that is also a reflection of why physio needs to be in the Big 4.
Yeah, exactly. I mean, listening sometimes as we're talking, and we'll talk a little bit about the Health Professions and Occupations Act, but I listen to some of the other professions who are so stuck on the areas like, oh, they're giving the provincial health officer too much authority to dictate what happens with vaccines. And I think to myself, because we got a bunch of calls when college bylaws came out, because one of the things is that in order to register as a physiotherapist, you have to have your vaccinations as the college lays them out. You have to have them up to date. And I had all these other professors calling me going, "Are you gonna protest that? Do you hate that?" And I'm like, "No, actually, that's not a thing for physiotherapy. Like, maybe there are some professions where there's a sort of a mass group of people say, 'Oh, we don't wanna vaccinate people,' but it's not this profession." And I love that because that says, "Look, we've looked at all the evidence and we recognize that the evidence is there to actually vaccine."
Yes. Yes, exactly, and, like, I think a lot of physios also know which battles to pick and choose too,
Yeah,
right? And I think we're becoming a little bit more selective over it, but you're right, like, that's an indication that, like, physios have taken their education and applied it on themselves and decided, like, this isn't a hill that we're prepared
yeah.
to die on because we actually believe in that thing. Like,
I
it's
mean,
it's
you
actually
trust the
important.
science, and in this day and age, I mean, I think yesterday, the day before, there was American president did that whole thing about acetaminophen and autism, and I
Yes.
wonder sometimes how more health professionals, even in the states, I know they're trying, but at what point do you just have to say there's no scientific backing for what you're saying? Like, and how can you not get people? How do you force people to actually look at the evidence? I don't know how you do that right now, but I think it's a strong sign for physio that I can go into any government meeting where they're talking about these terrible vaccination policies, and I don't think, "Oh, my physiotherapists are gonna be so upset." I think, "No." They're gonna be like, "Yeah, everybody should get a vaccine. Good
Yep,
plan."
science.
Yeah, exactly.
Science. Yep,
Exactly.
exactly. So physios are scientists and have been educated as such and are, again, it's like a strong representation of evidence-based practice when that's a non-issue for them. So
Exactly.
yeah, I
I love
I
that.
totally agree.
Well, those are my thoughts on the impression. I really love working with physiotherapists. It's definitely it's a privilege for me. And so far of the health groups I've worked with, and I'm not planning on working with all of them in my lifetime. This could be it, but absolutely my favorite to work with. I think every profession has different challenges that it faces, and you sort of learn quickly what those are. But I mean, I came from two professions that were very much under the thumb of a more hierarchical profession. So doctors with nurses and dentists with dental hygienists. And so it feels a little bit more like an open runway in physiotherapy where the opportunity to get past that is just that much greater.
Yeah, yeah, that is really interesting actually, especially because, yeah, your background is nursing and then dental hygiene where, yeah, they kinda have this, like, other entity that is, maybe not in competition, but kind of positioned a little bit more above the other one. So, yeah,
Exactly.
like, there's
Well,
really nothing ahead
we
of physio.
struggled in dental hygiene because they amalgamated the college there too, but most dental hygienists work for dentists. So
Yeah,
already the power dynamics are strange, right? They're an autonomous profession,
yeah.
dental hygiene, but they do work for dentists. So I always, when I was working in dental hygiene, I used to ask all my friends, Have you ever been to a dental hygiene appointment and had your blood pressure taken? Because that's
Yeah.
actually a regular and normal part of their scope.
Yeah.
But I've never had that happen.
Yeah.
And so that's
Interesting.
often because the dentist will say, "Oh, you don't need to do that," or "I'm going to have the machine in my office, so I'm not going to share it," or whatever. Like, so it's an interesting power dynamic because the dentists really do run the show. It's their office, right? It's their income.
Yeah.
So yeah,
You know something funny, actually, total aside here, but my sister's a dental hygienist and actually opened her own dental hygiene practice in Quesnel and has
nice.
been operating independently, and I am so proud of her. Like, it
Or
is
yeah,
so, so cool because she felt the same way. She felt she didn't have the autonomy she needed to practice in the way she wanted to, and saw an opportunity in the market and, jumped on it and is doing super, super well. So,
that's
yeah,
awesome.
there's like I'm very proud of her. And, obviously I'm someone who's rah, rah, rah business, like, let's go. So I've been very encouraging of her to move in that direction.
I will always support dental hygienists. I actually just took on um, a teaching position at UBC, a clinical instructor position at UBC, and it's teaching within the faculty of dentistry. It's teaching
No
government
way.
and advocacy and the democracy and all those things. So yeah, I will
No
always
way.
hygiene. Yeah,
Congrats. That's really cool. That's amazing. I'm sure you've probably, like my sister, probably would have overlapped with you at some point in that. But so that's helpful context too for like understanding what your background is as you've moved into PABC. So I'd love for you to kind of give me maybe like a recap of the last 2 years or like almost 2 years of your life at PABC and what some of the like biggest like highlights, Coles Notes version of like some of the biggest wins that you've seen with PABC, because right now it is renewal time. And I think we've really like I'm really trying to get people to renew, reminding people left, right, and center, renew your PABC, become a member, because I totally see the value. But I would love to kind of go through a bit of like let's go through some of the big wins that you guys have had over the last 2 years, because I think, yeah, it would be a really strong reminder as to why people need to be members.
yeah, absolutely. Well, I'm going to start with what I think is probably the biggest, which is the fact that our regulation has been updated.
Yes.
So if people are unfamiliar, your scope of practice is actually contained within the government's professional regulation for the profession. So there's a physiotherapy regulation in BC, and it was last updated in, I think, 2010. And the scope of practice statement basically said a physiotherapist can perform physical therapy. That was it. That was your whole scope. And so what government does is they'll write that, and it's enabling legislation. So they write that, and then the college takes that and they actually build out their interpretation of it, which is what you sort of, when you say, well, my scope of practice is bigger than that, but they go into the details. What are the standards? What are the limits? What are the conditions? But we had been asked prior to the amalgamation to submit our thoughts on a new physiotherapy regulation. And our scope of practice committee at the time did a huge amount of work. And I have so much appreciation for the amount of time that they really went and looked at every single word and every single clause of that. And there were some things that we had suggested they hold on. I think maybe they didn't. Well, one of the things was certified practice because it's a very complicated thing and not something that physiotherapists are used to. And so we had sort of said, we might need a little bit more time to actually figure out what certified practice looks like in the profession, but it did end up in the regulation. But there's a few things in it. So one is the scope of practice now is about 3 paragraphs. It's quite long, but it's using almost all the words that we gave them. So they really did listen and said, okay, well, if they want that word diagnosis and this is how we're going to refer to it. So that was really great. The other thing the government did was that they gave physiotherapists for the first time restricted activities. So restricted activities are things that there's a long list of them, which you can look at online, that says in British Columbia, these are things that health professionals can only do if they're actually given the authority by government to do so. So that's what a restricted activity is. So, I mean, I harken back to my nursing days when it was things like you can't stick your finger farther than, an inch up someone's nose or whatever. I mean, it's things that can be really harmful to the public. And so for the first time, government did give restricted activities to physiotherapists, which is actually a sign that government is saying, okay, we may only give this particular activity to doctors, physiotherapists, and who knows, right? It depends. So that was a real win for us. And there's still things around that regulation that we need to kind of hammer out. It comes into effect on April the 1st, 2026. along with the Health Professions and Occupations Act and a whole bunch of other government messy legislation. But that one was a huge win for us, because really to not have the scope change for so long really was putting us behind. Granted, there are still things that we want to do. So right now, we've been working on imaging, getting imaging into the scope. When I saw the regulation, and we knew in advance that it wasn't going to be in there, but at the meeting that government had with us, I said to them, well, what about imaging? And that Assistant Deputy Minister rolled his eyes. He's like, Andrea, we know, we know. So they've committed to continue to work on that piece, even as they're, I mean, you have to imagine right now government is rewriting 32 pieces of regulation and everything else. So the fact that they continue to agree to look at it over the next few months is great for us. So hopefully within a year or so that decision will be in the books and we'll be good to go. But that was a huge win.
Yeah.
Huge win.
Huge.
And when I first started here, everyone was like, oh, scope of practice. We've been working on that for years. And I was like, well, then that would be my first thing. But it wasn't my first thing, because I walked in the door and I think it was like within a day, PBC audits blew up, and we were getting all these calls from physiotherapists really worried about what was going on and worried about the changes that, well, we can argue it to the end. Did they make changes, or did they just publish changes? They just published things they already said they were doing.
Yeah.
It's sort of here, there, and nowhere, because what they had done is gone back 3 years and audited based on a document that they published in 2023. So audits for 2021 needed to adhere to the 2023 document, which apparently you were all supposed to be psychics and know it was coming. So so that was a bit gnarly, and because our website was outsourced at the time to a firm in Ontario, and we couldn't actually make a lot of changes to it. We decided we're just going to put up a website really fast to get the word out, get the conversation going, get as much information as we can from physiotherapists, and share what we can. I mean, Danielle, you probably know me well enough now to know that I'm not one of these people that likes to keep things top secret. I don't believe in it. I didn't believe in it when I worked in government. They would say, oh, we can't share anything. And I'd be like, oh, give me a break. 95% of what government has to share is not top secret. They just don't really want people to know. So good, bad, or ugly, my thing is we're going to share what we can and try and get information out. So it was an interesting start to a new role. It's just like, wow. But a few things that I've learned over the years. One is the first thing you got to do is go to legal when something like that happens, because really the lawyers are the experts in what's actually allowed and what's not allowed and what you can and you can't do. So we immediately went to our lawyers. So, well, lawyers that I'd worked with before. So Sandra Hawes from Miller Thompson, I'm sure you've talked to her in the last few months, because she was vital for PBC, but she's also been vital for ICBC for sure. And so part of it was going to lawyers and saying, like, what are our opportunities? And part of it was trying to reestablish the relationships with the insurers, which hadn't been super strong. So when PBC happened, I didn't have the ability to pick up the phone and call Sarah Hoffman, who's their CEO, because PABC didn't really have a relationship with them. Now I can call Sarah and say, hey, let's chat this through. Let's figure out what's going on. But we didn't have that at the time. So it was rebuilding that relationship. So then we could say to them, okay, we want to sit down and have a task force, and we want to work through each of these things and try and come to a consensus. I'm not going to say that PBC is a win yet necessarily. It's advanced. We're getting there. We continue to meet as a task force. We have had some things done that were bothersome to me. They're different than private insurers or than public insurers, because they get to make decisions. And we don't necessarily have any say in it. So one of the things that right off the top is that they were talking about the scope of practice. And I kept saying to them, that is a really specific meaning in healthcare. And your scope of practice, you know what it is. You're talking about scope of coverage. The scope of coverage is different. So once they changed that label, I think a lot of physiotherapists went, oh, yeah, okay. That's not the same thing. You can't tell me I'm breaking my scope of practice, but you can tell me what your scope of coverage is. And I don't love it. I don't love that I think I'd been here 2 months when I had to call the kinesiologist ED and say, I'm about to send out an email and put all your people out of work. And it feels horrible right before Christmas, and it feels horrible anyway.
Yeah.
He knew it was going to come, but I really struggle with what's happened to the kinesiologists and PTAs who are working in that support role in private clinics, because most of them have either lost their job or have had it so minimized. And some
Yeah.
of these people had the same patients for, years and years and years. So
Yeah.
that's been very hard. And one of the challenges that we still are grappling with is that PBC has said to us, we would happily look at the use of PTAs, but you have to be able to show us evidence that using PTAs provides better outcomes than if you don't use PTAs. And of course,
Right.
because physiotherapists have built the PTAs under the physiotherapist, there is no way to distinguish that data, right? So it's been really frustrating because there's not a lot of really good, solid empirical evidence that says this person would do better with
Mhm.
PTA involvement than without it. And so if we can come up with that, that saves the day. We have had a few conversations recently about some of the group therapy that doesn't get labeled under exercise classes and Pilates, and bringing some of that back. So like the GLAD program and some of that. So I'm
Yeah.
hopeful that we can make some headway on some of those things, but I don't think they're going to back down on the one-on-one with the physiotherapist.
Yeah, I agree. But that was a huge lesson, the difference between scope of practice and scope of coverage. And I read those T's and C's because I used PTSWs regularly, and I remember reading that and being like, "Yep, as long as it meets scope, great. What's the scope? PTSW. How does the receipt look?" Like and I had conversations with the college about it. Like I remember being really on top of this and really aware of it and documenting in such a way. And then, having this come out that it wasn't covered was shocking to me. And all it said was as long as the physio is registered and practicing within scope, that's all the public information that we had. So it was really that was a new term for me. What is scope of coverage? Like that was a completely new
Yeah.
concept to me, and obviously one that I am very familiar with now. But yeah, I think a lot of physios were not familiar with it. I think that was a whole concept that many, many clinic owners and practitioners learned about in real time. And yeah, it's something like we all need to be aware of now, obviously. But I think establishing that relationship and communication with the insurers is essential so that they can know when it's not clear what the scope of coverage is and vice versa, right? Like having that dynamic, interactive conversation is essential
And
here.
I was shocked when I came here. And I learned that fees are set by the insurers, and physiotherapists mostly just go, oh, okay, well, then that would be our fee. And I'm like, I came from dental hygiene, which is not exactly like, the loudest profession in the world. But in dental hygiene, in the late fall, the insurers would call me and say, can you send us your fee guide for next year so we can set our rates? And that was what they based it on. And we knew that if we set the rates, I mean, if we had said we're increasing a rate by 90%, they would have laughed at us. But if they could see the rationale for it in the formula, then they would just do that. So when I
Yeah.
came here, I was like, what do you mean the insurer set the rates? Well, no wonder your rates are so terrible. Like it was a shock to me.
Yeah, big time. And I mean, obviously, we've had plenty of conversations around fee, and now PABC has the fee guide. And right now it's a challenge because a lot of clinicians and clinic owners are a bit resistant to increasing their rates so significantly. But I think you're right. Having the profession set the fees and then having the insurers respond to that and pay adequately or pay in reflection to that is the way it should be. Like it's
Yeah.
really using Pacific Blue Cross's customary 30, 45, and 60-minute rates to determine what our rates are is like so backwards.
Well,
But again,
you
it's the way it's
never
always been.
they're never going to increase that way, right? They have no reason to increase. And I struggle a bit too, and I think I've probably mentioned this to you. When the national survey was done last year, BC's rate was between $50 and $500 for half an hour. And I was like, or no, for an hour, sorry, for an
Yeah,
hour. And
yeah.
I was like, so an hour of physiotherapy at 50, who are those physiotherapists? Like, first of all, I'd like to know that because I'll go there.
Yeah.
But oftentimes I would meet people and they'd say, well, this is in my community. These are my friends and family. And I'm close to retirement. I don't want to charge more. And I would say to them, but you're underselling everyone in the area, not only locally, but really in the province. And on the flip side of that, there's a physiotherapist who was calling it $500 an hour. And I actually got subpoenaed for that. And so The reality is, I mean, the judge said to me, like, "Is $500 a reasonable rate for an hour of physiotherapy?" And I can't say yes. I
Yeah.
can't say yes to that.
No.
Not for standard service. So, I mean, the problem is though that then insurers look and then go, "Oh, well, the rate is between 50 and 500. We can charge anything between that." So we need to get people to come a little bit closer to that
Yeah.
110, 120 rate because
Yeah.
it doesn't make sense to be that far off. And it just gives your insurers the opportunity to poke holes in it. But I
Yeah.
will say I was really pleased this year that Canada Life actually had reached out to me a couple weeks ago and asked for our fee guide. So I was like, oh
Yes.
yeah, they're starting to come, so we'll get there.
It's
But,
happening. Yeah.
it'll take some time, and I've been very impressed with certain clinics. There's a group in Victoria who just were like, "No, we're just gonna go with the rates, and we're just gonna make the increase and see what happens," and they didn't end up losing patients.
Yeah.
Patients get it, like, to
Yeah.
make sure you can turn your lights on.
Yeah, exactly. And I mean, obviously, like that, the piece that I wrote, I really tried to break down the reasons for why that is. But running a clinic is no joke. Like, it is not cheap. I'm currently doing some consulting with a clinic owner who's running all the numbers, and like, rent isn't the only overhead, staff isn't the only overhead, right? And I think a lot of clinic owners start with good intentions and thinking, like, oh, I know my overhead. I can be quite generous with my splits. And then end up in a position where now they can't keep the lights on because they aren't bringing in enough in terms of paying their overhead. And because those are the standard splits and rates and whatever in the province, other people follow suit, and we've ended up in a scenario now where overhead has risen but fees have not.
Yeah. It was actually Brian Waltz who first sort of flagged this to me because I was talking about the fact that as an organization, PABC is a living wage provider.
Mhm.
And it really that's key for us, right? We need to make sure that people are paid a living wage. And Brian was one who wrote, and he's like, it's very hard for physiotherapy clinics to pay the front desk staff a living wage. We just
Yeah.
don't have enough profit. I see
Yeah.
that's not all either. I mean, there's a part of me that wants to go out and say to the public, really, you think you should only pay $90 an hour for physiotherapy? So you're okay with that person over there making $18 for the work? I think there's something to be said for that. So yeah, the overhead is more than people understand. And the
Mhm.
amount of protection that clinics need to have for themselves too to make sure that they're protected is also
Yeah.
significant. So I would like to see the rates go up. I would like to see the rates go up in public practice as well. And
Agreed.
so,
Yeah.
the let's just say that negotiations with any union right now are not going so well for anyone because, I actually ran into the deputy minister the other night and I was like, oh, I really want to come in and meet with you in the next couple of weeks. I've known her for years. And she's like, there's no money, Andrea. And I'm like, I wasn't even asking for money.
Okay.
This is where government is at, right? Right now it's making cuts and
Yeah.
savings and really going into sort of these measures. So, the unions aren't getting great offers. They're not. And,
Yeah.
you know, I think for me that the recognition that, I'm still on some of the online forums for nurses, for example. And then they're gonna hear this and kick me out, but that's okay. Um, but I hear their comments about what they think they should be getting, and they're talking 20% increases for the next 3 years, and, there just isn't that kind of money in the system, and so when it comes to negotiating around physiotherapy, I think for me, what our role is going to be is really taking whatever that draft agreement is that comes out, and maybe what we need to do is get that to the lawyers and say, what is in here that's a sticking point? Because I'm not sure how familiar people are, but in the last contract that was negotiated, there is a reclassification that came into that. And it's really sort of changed where physiotherapists sit if you're a PT1 or a PT2. But I
Yeah.
don't think, if you're trying to sell a contract and you want your members to vote for it, you're probably not raising stink and saying, you guys are going to really hate this. And OTs and PTs have come to me and said, like, we don't like this. Can you help us? And I'm like, you ratified the agreement. So we really can't change what you did. It's really about making sure whatever's coming forward this time that we can look at it and say, you know what, this actually is something that our lawyers need to flag as a problem. But I
Yeah.
will add to that, the HSA, which is the union for our public practice, has a ton of professions in there.
Yeah.
And so it's not just physiotherapists looking at it and saying, yeah, we can live with this for physio or physio and OT. It's it's labs and all these other groups. So, we might not love it, but if the other groups do, it still gets ratified, right? So that's a complicated and hard thing, but it's as it comes forward, I think we're gonna need to be very conscious of it because as goes the fees in private, so does public, and vice versa, right? And
Mhm.
the public practice side keeps saying private practice is stealing our practitioners, and I'm like, well, I don't think I'd say it's stealing. I think that it's opportunity, right? And people are going where there is some. So we have to somehow make sure that we can support both sides of that,
Yeah.
and parity is important, but it's going to be tough when right now. I mean,
Yeah.
government just like no money. We got no money.
Yeah. Well, and it's interesting too because the scope of practice piece, I think, would also be a huge like win in terms of negotiation for the public. Like I've actually been working in an urgent care center in the public system with Interior Health, which is like a complete 360 from what I was doing 2 years ago. But yes, I'm aware of like now all the union stuff and the rates of pay for physio, and it's like I'm doing assessments that I am then, working with the physicians about what imaging to order, right? Like I'm not just mobilizing patients in the urgent care center. I am assessing and diagnosing and determining if they need to see a doctor for imaging or, care at home or providing treatment. Like it's a role that is frontline diagnostic and like really should be quite honestly paid a lot better than what it is being paid. I like the work. I like the casual nature of it. That's, for me, it works. It's fine. But we're doing the same, like, we are considered practitioners there. We are getting referred to like they would refer to a nurse practitioner or to a doctor and doing the same type of work that they are, right? So imaging would be amazing. But if we get that, that's also a huge negotiating tool for increasing those rates too, because now they don't have to pay the doctors to do that.
Exactly. So, I mean, we have a position statement coming out on imaging, should be sometime in November. So Jason Craig on my team has done an amazing job pulling that together with a group of physios. So one of the things that what we changed was to move away from the idea of having specific committees that you had to commit to long-term working on a committee and you had to come to meetings and have terms of reference, and really instead going with call outs, which you see happen fairly frequently on our website. For example, right now it's WorkSafe. We just put a call out a couple weeks ago to have a group of people who are invested and interested in helping me negotiate the service terms for the new WorkSafe contract. For me, it's really important to have people who, first of all, are really interested. And so, we could have a committee on something like we could have a negotiations committee. But if you have a committee with that with terms of reference and I have someone on who's like, I want to negotiate ICBC, I'm like, well, you got nothing to do right now. But they're still part of that conversation while they're sitting there waiting for WorkSafe because they don't care, right? They don't take WorkSafe patients. So this way it means that we are really targeting the people who have that sort of the knowledge, the expertise, and the frustration in that
Yeah.
specific topic, which has
The
really been
investment
helpful.
in it, yeah.
Yeah, it's
Yeah,
really helpful.
absolutely. So that's a good opportunity then. Let's maybe do a quick update kind of on what is happening with ICBC, and then I wanna actually hear a little bit more about the WorkSafe contract. So, yeah, where is ICBC at? I know we've had some small wins there as well, which is really
Well, I
cool.
don't think they're small. I think they're pretty big.
They're really big, yeah.
So
Yeah.
ICBC sent out their service terms, the new service terms. I think it was in November of last year. It's been about a year. And we had not seen anything about them. We had seen a little bit of the physiotherapy guidelines they'd asked us to look at, but I had been frustrated even by that because ICBC has very strict ironclad non-disclosure, even with me. Like I can't share stuff with my board. I
Mhm.
can't share, which quite frankly is borderline inappropriate because I need physiotherapists to look at documents that are that impact physiotherapy,
Yeah.
but they never shared the service terms with anybody. And so the day they sent out the physiotherapy guidelines, they sent out the new healthcare service terms. And I was shocked. Like why would anybody sign that? I could not believe the amount of a risk that would be involved for someone in signing that. And probably the exist example, I mean, there are some really strong pieces in it, but the first thing that jumped out at me was that you had to comply with the ICBC Code of Ethics. So I was like, okay, I'm going to go read the ICBC Code of Ethics. And I'm
Yeah.
reading this thing and I'm like, it absolutely, they could maybe enforce it with their staff. It's pretty heavy handed,
Yeah.
but there's no way that they can say to a physiotherapist, well, you do physiotherapy for us. So you need to tell us if you get a speeding ticket. No, no, that's not happening.
Yeah.
There was stuff in there about you can't accept any kind of gifts, including like, you know, Christmas cookies from a patient. Like, it was so extreme. You have to report any bullying to ICBC Human Resources. What? Like, that doesn't make sense in a private clinic. It doesn't make sense if you're in public practice. You have a whole structure for that. So there was so much of this, just the code of ethics that I was like, I, I think the unfortunate thing is that you're agreeing to it if you sign on.
Yeah.
And then, sure, ICBC would say to me, well, Andrew, we're not going to enforce it. And I'm like, but what if you do? What if it's different leadership? What if ICBC suddenly has a deficit and they're like, oh, we could make some money by going after all these people who are not complying with our code of ethics? So that was sort of the first thing. But there was three things that jumped out at us. That was one. One was the ability for ICBC section 6.3. Isn't it sad that I know that? But for ICBC
I do
to
too.
come into any clinic and access any computers or any systems. And it didn't specify that had ICBC information, ICBC patients. It also didn't make any distinction between this is the desktop computer on the front desk, and this is the phone that I have in my pocket that has the Jane app on it, so I know what my appointments are. And so we're like, so this really, you could seize people's phones, their tablets. And I think most people look at the seizure of their phone as a very personal thing. It's not like you have your phone just for Jane app.
Yeah.
I remember saying to one of the folks at ICBC, like, you don't have the right to monitor things like if this person is looking at porn on their phone. Maybe you don't like it personally, but it's none of your business. It's not illegal in Canada, right? So I think that one really struck people as inappropriate. And then the other part was when they talked about ICBC adjusters and auditors being able to talk to patients and make a decision around substandard service. I'm like, I'm pretty sure the only ones who can set that are college. I don't think when it comes to practice that ICBC has any right to say you did this wrong, this was inappropriate. So those were sort of the three things that jumped out at us. We had a total of 10 that we went back and forth with. And ICBC from the beginning, and if any of your listeners talked to them, a lot of people did, they were just told we're not changing it. Like, too bad for you. It is what it is.
Yeah.
And that was the answer that we were getting to. And so for us, it was a matter of being really strategic about the advocacy for that. So I know that we would have members say, we need to go on the media right now. And I'm like, no, it's not time yet. It's not time yet. I have to preface that by saying I worked in government for a lot of years. I worked in public relations for government. So I have a very good idea of here you chugging along and everything just going like this. And this is the moment when you're going to go for it. So we did jump on the media when we kind of got to a place where I was like, we're stalling here. And that was great. We had a couple of interviews with various people. Honestly, if I walk up to any reporter any day, anytime and said, I have an ICBC story, they'd be like, woo, bring it on.
Microphone.
I sometimes feel sorry for the people who have to manage that relationship with the public, but there it is. And then eventually it was a letter to the minister's office, which does have oversight of ICBC, and saying, we want to sit down and meet with you and have a conversation around this. I went to Victoria with 3 or 4 members. We sat down with Minister of Public Safety. Unfortunately, it was right after the Lapu incident, so he was a little busy. But after the meeting, I remember one of our members saying to me, like, did that do anything? It was half an hour we were out there. And I'm like, oh, yeah. Because the only thing we needed from that meeting is a commitment from government to intervene.
Right.
Have a facilitated session between us and ICBC, and you facilitate it. That's all we wanted. They weren't going to come out and fix it. And so we got that. And that was an interesting conversation because the interim CEO from ICBC was there, as well as government and us. And, they were like, well, we looked at your list of things and blah, blah, blah. And we're going to make some changes in November. And I was like, well, that's great. But you need to make 2 changes now. Yeah. And that is the substandard services. Yeah. If it's really talking about just billing, then you need to write that. You need to say substandard billing and administrative practices because that changes that entire sentence. Fine. Yes. I'll be fine with that. And you need to change this language that says you can come in and look at anything and take anything. And you need to talk about ICBC data and information. And you also need to say that audit of offices is the last step in the approach to working with people who are being audited. It's the last thing you're going to do. They've actually never done it, not even once. Yeah. So it's such that if you make those changes now, we will endorse the contract. Yeah. Knowing that the rest of them are coming, but those are the ones that, for me, were the most risky for our
Yeah.
members. And so they went away, and then they came back and said they would. And I was
Yeah.
actually in Qualicum for the month and on vacation, and they called and said we needed to come for a meeting on the 18th. And I was like, oh, well, go back to Vancouver just for this one meeting. I'm gonna not want to go. So can I call in? Well, no, you can't really call in. And can I send someone else? Well, and anyway, eventually I came back. Boy, was I ever glad, because they handed it out to us and I read it and I was like, oh.
But
So
you
they
did
were
it.
like, everything you needed is there. So the rest of
Yeah.
the changes will happen. They'll be announced on October 1st. They'll happen on November 1st. There's only 2 things in it that we ever raised, but I have a strategy anytime I'm advocating for something. Like if I'm going to go to the government and say, here are the 3 things that we want added to our scope of practice. So we want imaging to be included. We want certain prescribing rights, and we want Botox. Do I care if we get Botox? No, I do not. But you give me 3 and then they can give us 2, right? So the 2 things that ICBC held firm on, which was not surprising, was the indemnity clause and the survivability. And both of those things are not surprising that most companies are going to hold on to those. But it was a huge win for us, because
Yeah.
that was the point in the summer where I was able to say, okay, we will endorse this. And I think this is safe for members now, because before that I was like, I don't think this is safe. And at the
And
end of the
safety
day,
for the public was a big part of that too, like when it came to the privacy aspect of it, because it wasn't clear if they could access any files or just ICBC or specific patient files too. So it's clearer now in the language.
at the end of the day, it's almost always about the language that you focus on, and how you word that, and how you make sure that everything you're saying in a contract like that is so clear. Because any kind of ambiguity, it can be read as something completely different in court than what was intended. And so that was our thing for us. And I mean, I was so grateful that when we said to physiotherapists to read it, that people really did, and then started going, wait a second, this doesn't make sense.
Yeah. Yeah. And then I think that opened up a whole lot of like, well, if that's what this one says, what about this one? What about this one? What about this one? And I think that was like a huge turning point from reactivity to proactivity. I
It
really think
was.
that was
And
the shift.
I think that physiotherapists, and it's not just physiotherapy, I guess I would say most of the health professions, with maybe the exception of doctors and nurses, maybe through the union, have been used to saying, well, we don't like that. And then when government says, too bad, so sad, they kind of go, okay. And so to have that pushback, and to know that I wasn't going to drop it until it was fair, I think is something that physiotherapists were not expecting. And I can tell you the other professions say the same. The chiropractors are always like, Andrew, you turned that whole thing around. But it's not just that it turned around ICBC, it sets the stage for everything that's coming. So
Yeah.
when WorkSafe came and said, yeah, management is pressuring us about changing the contract, because our contract is actually not up for renewal now. It's just going to be renewed and changed.
Mm.
When they came to me, but they were like, well, we don't really want an ICBC situation. Well, what can we do to avoid that? Well, let's work together and make sure that the service terms are things that we can live with before you plop them on everyone's head and say, this is how it is, suck it up. Because WorkSafe is in the exact same position as ICBC. They are government oversight, right? So, and I'm like, well, you know what I'll do if you're not reasonable. Like it's very possible to go back to government and have a really good conversation. And as I've said to ICBC many times, it was never personal. And I think sometimes some of the professions feel like they're getting involved with people at the workplace, and that there's some kind of personal antagonism, and it's never personal.
No.
It's about policy and management, and trying to say this is what's fair and this is what's not. There should never be a situation where both parties aren't thinking about what's negotiable here. And so when ICBC were like, we're not negotiating it, I was like, oh, well, yeah, you are. We can negotiate this in the court of public opinion, which is in some sense what happens, right? So,
Yeah.
so it did set the stage. And I think now physiotherapists understand, for me, that I will fight back. I
Yeah.
will fight back. And if you
Yeah.
fight back long enough, eventually you get at least part of what you need to have happen. But
Yeah.
my sort of bottom line on all of it is, there are lots of things that we have to accept that we don't like, and there will be in the future. But if it's not safe for physiotherapists, if it's not going to protect them in their job and protect them in their clinics and keep them able to function and work, if it's not safe for the public, then we're going to fight it. Right?
Yeah. Yeah. No questions asked.
So the next thing
So,
with ICBC is treatment plans, because
yeah.
physiotherapists are doing them for free. Thank you, Air Canada flight attendants, for making the point that you shouldn't have to work for free. That's awesome. It's just
And getting that change. They got that change. So the fact that that precedent is set is good for us on
lead right
treatment
into our
plans.
hands. So I mean, ICBC had said that they were going to look at this. They are. I don't love the plan that they've laid out, because in typical government bureaucracy, it's like moving the Titanic. It's very long. So I think that you'll probably start hearing some more about this from us. We're just trying to figure out what we can do in terms of advising practitioners around that, because, one of the things I said to ICBC was maybe that, everybody gets to book 1 half-hour appointment with the patient. That is just about right in the treatment plan. Do it during the appointment and you get paid for it. So they don't like that. But
Yeah.
this is kind of where we're at now, at a place where we're having to say, we need people to step up. And, I think, we looked at the numbers from ICBC, and every other profession got an increase, but physiotherapy. And it's actually the chiros who are the most mad about that. But there's also a part of me that says there's some point where if that's the way ICBC is going to go, and if government continues to be in this sort of money spent, then we say to people, like, set your rates at what you think the rates are, and it's a copay. If it's more, it's a copay. Most
Yeah.
people will pay $10. ICBC doesn't like copays, but you
Yeah.
know what? Then pay people what their value is.
Exactly. Exactly. That's just it. If you don't like it, adapt.
Yeah. So treatment plans are up next, and we'll see where we go with that. But there's a whole review taking place that the Crown will run. Well, there's 2 reviews taking place. One is ICBC run, and I'm a little unsure how that's going to go. We'll see. The other is run by the Crown. So the Crown has committed to doing a 5-year review of enhanced care and no fault insurance. So that will
Okay.
start to take place in the fall. And they've chatted with
Wow.
us about how we can help them make sure that physiotherapists have opportunity to share their stories and experiences. And so
Wow.
we're going to really encourage people to be honest about how they feel about that. And it doesn't go
Yeah.
to ICBC, because I know sometimes people say, well, I feel like if I say something bad, they're going to blackball me or whatever. And this is a completely the Crown. So it's completely separate government review. So
Awesome. So independent and yeah, somewhat objective. So what direction is the WorkSafe contract going in then? Like, are there any like major terms there that you guys are looking at, or what's where does that one stand?
so we're not looking at terms yet. So as you know, they gave the current contract extension till December, and then they've just extended again till March the 16th. So you're on this call and they're like, so it'll be April 1st, 2026. And I'm like, oh, please don't do it that day. That's the day.
Oh
Go
no, that's
away.
already a really busy day.
Not do it that day. Plus, I mean, I said to WorkSafe, you don't actually want to be attached to that.
Mm-mm.
That train is coming really fast and it's going to run over a lot of people. So don't have your name be anywhere near. So anyways, it's going to be March the 16th. So what they've committed to is a review of, so they've been doing some reporting over the summer on a few things. We've heard some of the things that are concerning, and there are some things that we need to look at too as a profession. So WorkSafe, of course, has a mandate to get people back to work. That's what they do. And
Yeah.
so sometimes you'll see cases where physiotherapists are working on the person for years and years and years and years, asking for an extension after extension. And there is a reality of professional responsibility, especially with some of these cases, where you have to actually say, you know what, you're plateaued. You're probably
Yeah.
not going to improve beyond where you are. You probably need to see an occupational therapist to talk about whether you can return to work or whether you need different job training or what that looks like. But some of those conversations are hard to have. And
Yeah.
I think sometimes physiotherapists think, oh, I'm just going to put an extension in. It's just easier to keep patient and they'll keep coming and I keep getting paid. So some of that's, I think, a reminder on our part around that piece of professionalism and just really reminding, all of our providers that you do actually have a responsibility to be thinking about, is this person going to get better, or have I maxed out the performance here?
Yeah.
So there's that part of it. But the extensions piece apparently is one thing that they're concerned about, that their extensions are just kind of happening by rote as opposed by need. And so I
Right.
understand that that's something that we can look at. They're going to want to look at rates again and fees and figure out what's reasonable. Um, there's always, I'm not going to call it conflict, but there's always questions whether it's PBC, ICBC, WorkSafe, around conversations that happen between recovery specialists, case managers, whatever you want
Yeah.
to call them, and physios. And that's another piece that we can work on.
Mhm.
I've done a lot of work on the downtown east side. And so people will say, well, people who are, they're always yelling in the hospital and getting removed by security because they're mad when they come in to see someone. And I always say, like, let's look at the flip side of that. If you have a serious injury or a serious problem and you are a drug user and you're sitting at St. Paul's emergency and you've been sitting there for 12 hours and they're triaging all the kids that have colds or whatever through because you're at the bottom of the triage list. By the time you go up to the counter, you're going to be mad. You're going to start
Yeah.
yelling. And then it escalates and security takes you out and you probably never get seen. But it's sort of a similar thing that I think sometimes physios get frustrated with the recovery specialist and they're like, ah, you're just not listening to me. And why do you get to decide whether or not this is appropriate treatment? You're a person who answers the phone. And then the situation escalates between both of them. So there's a certain amount of conversation about how do we cool down some of that rhetoric so that it's cleaner. And then we had this interesting task force meeting last week with PBC, and we started talking about charting and what flags in a chart for the different insurers that makes them go, okay, we're going to audit or we're not. And so one of the things that we're going to do that we've committed to do along with the Kairos is to actually start building a glossary of terms that would be shared by all of the health professions across all insurers. So that,
Wow.
if I use these words in this way, it's not going to flag any insurer, no matter if I'm a chiro or I'm a physio or whoever. So we're just getting started on that, but I think that that will be helpful. One
Mhm.
of the things that we've talked about with ICBC about treatment plans is let's decrease the amount of work that, like, they kind of keep getting bigger, right? Like, let's decrease that. Let's decrease the number of times they have to happen. And part of that is let's make sure that we have a shared language so that everybody knows
Yeah.
what you're asking for. And so one of the things that has triggered audits from PBC is when people write reps, right?
Yeah.
Which is a very normal thing to put in someone's chart if you're a physiotherapist. It doesn't mean you're
Exercise.
running an exercise class, right? But that needs to be explained so that when someone is looking at it from an audit perspective, they're like, oh, this just means that they showed them to do this and they told them to do it 10 times or 3 times
Yeah.
a day. It
Yeah.
still means that they're saying, come in 10 times, 3 times a day, and I'm going to charge to walk you through it again. So I think some of that will really help. I think that will be a really good step forward. So with WorkSafe, so they've committed to meeting with, we have a small group, there's about 8 people who have expressed interest in being part of that group. We'll review some of the reports. Our first meeting is October the 1st. So next week, basically, with WorkSafe, we'll sit down together. We'll talk about what the plan is. They want to do a webinar type thing for everybody to talk about
Mhm.
some of the things that they've learned and understood. So we'll put that together. And then the small group will actually start negotiating with WorkSafe around the services agreement. They don't call it negotiating, but working with, right? So,
Yeah.
because they don't negotiate, blah, blah, blah. But we'll sit down and walk through the contract with them. And really that gives our folks a chance to say, wait a second, this part right here isn't well done. So that would have saved the day for ICBC to be able to say,
Right?
wait, your language here? What do you mean substandard service? Do you mean
Yeah.
substandard billing? Oh, fine. Let's put the word billing in there. We're good. So I think
Right?
that it will be a much better process than what we had. And
Yeah.
hopefully the one that comes out on March 16, everyone's feeling like, oh yeah, that's something that we can get behind.
Totally. And it just sounds so much more collaborative, and like the fact that they value the input from the profession, like that just feels like, oh, this is a two-way conversation. This isn't just like a heavy-handed, like take it or leave it.
No, it's definitely better. And, we worked really hard the last 2 years to really build up those relationships with these key folks. So
Yeah.
I think it's important to do. And then the other one is MSP, of course, that we know we have
Yeah. Yeah.
a lot of work to do on. And, the fact that we went to the finance committee and that they did mention it in their report is significant, but there's no money in government right now. However, I did have a chat with the deputy the other night, and I was saying to her, like, the only money I would ask for is actually through this MSP situation. And it's funny because I said to her, so the last time that the MSP rates were increased for people was when you or I worked for the minister and I worked for the Minister of Health. We worked together for him at the same time. And she's like, I was like, yeah, 2001. Like, it's been 25 years since that rate has been changed. So then, I mean, we talked a little bit about some options, and I think she wants to hear more about what's happening. And I think it's something that is more insidious than people realize, and it's gotten worse. So when I first started, I didn't hear much about it, but I probably get maybe one or maybe two calls a week now from members of the public saying, listen, I make less than 40, so our family is in that low income. And I had surgery and I was released after one physio visit, and they said, go find a physio and come back. And I can't find anyone I can afford. Even
Yeah,
with the $23, they're like, the copay is 40. I can't pay 40 bucks a week.
exactly.
And so we have so many patients that are starting to fall through the cracks. So then what
Yeah,
do they do? Well, I mean, they say, well, then I'm just going to wait and go back on the surgical wait list because it's free, which
exactly.
does not save the healthcare system any money.
Exactly. Yeah,
So,
people default to like cortisone injections and surgery, which are
yeah.
far more costly than
And I know our
physio.
public practice physios will say the same. They're like, people call me, even though they've been released, but they'll call and they'll be like, I can't find a physio. And none of us have an answer. Like
Yeah.
I can't say to them, we actually have one guy in the lower mainland who will go for free. And he said to me, like, anytime you have a patient like that, just call me and I would go see them for free and they'll do what they need to do.
Wow.
But
Wow.
you have to be end of career and have made enough money that you could do that. Like most physiotherapists can't be like, I'll do it for free. I know a
Yeah.
lot do it right now. I know there are a lot of physios who are doing pro bono work
Yeah.
when those patients come in or are, charging them $15. And I know there's also a
Yeah.
lot of physios who never bother with the $23 MSP because
Yeah.
by the time you process it, you've spent as much time as that on the paperwork. So we definitely need changes there, and that's going to be a big focus. And the biggest challenge right now is there's no money.
Yeah. 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 Exactly. How do you if
Yeah.
there's no money, how do you find more money? Yeah, no, I get that. The last big one that I want to touch on is the Health Professions and Occupations Act. You're shaking your head. It's a big one. It's a meaty one. And I mean, let's maybe just do a brief overview of what it is. But I think the really important thing is that the profession goes and looks at this and reads it and reads your blogs and reads your updates on it because it's going to affect us in a major way.
I would not advise anyone to go actually read it.
It's huge and gross.
I have a binder like this. It's 300 and some pages, and it's all legal, right? So
Yeah.
it's not easy reading by any stretch. Um, it's the biggest piece of legislation I think any of us have ever seen, and by any of us, I mean anyone who works in government. And I remember talking to the media right after it came out. They're like, the act, like
Yeah.
generally when there's any kind of substantive legislation, the media and some of the associations usually find out about it a week before, and we're sent copies like embargoed so we can have a look at it. Didn't happen with this. And I actually remember I was actually at I was with dental hygiene, so I was at a conference sitting across the aisle from someone from the dental association, the CEO from there, and our phones pinged at the same time and we both picked them up and we were like, what do you mean it just dropped? Like, where was our warning? And from then it was a month. It was passed through the legislature in a month, which is unheard of.
Yeah.
And I don't know. I mean, I'm a political junkie and I will watch it. I will watch Question Period endlessly. But when it was in third committee, so it's like any kind of bill, right? It goes through committees through the legislature. And so the last chance was the last day that the legislature was sitting, and Shirley Bond was the opposition spokesperson. And for most pieces of legislation like that, you go through literally clause by clause and you ask the governing party, what does this mean? What is your intent for this? And so she got about a quarter of the way through, maybe. And then it was the end, and they called it. And, their response were majority government. We can pass it if we want. And they did. And so it was shocking how fast it was. It was frustrating for all of the associations because although they'll say they consulted, what they consulted on and what they ended up doing were not the same thing. And we would say that across all of the associations. So the associations meet all of the regulateds and a few of the unregulated. We meet every month, the last Friday of every month. So this week. And we talk about the things that we share, the concerns about, the things that we're seeing in the government space, the things that we need to work on. And I think we've all been a little bit shocked with the speed and with
Mhm.
just some of the significance of the changes. But it's 300 pages. So trying to transliterate that into something that people who are working and are busy can understand, this is how it's going to impact me, very, very challenging to do.
Mhm.
And God love the college. They have so much to do right now with amalgamation and just the change management and the culture and 9 professions. I mean, as professions, we call ourselves the College of Misfit Toys. That's not the college's fault. But we're like, it's very hard. Can you imagine trying to figure out how you do one QA program for optometrists, dietitians, physiotherapists,
Yeah.
psychologists? How do you balance any of that? Psychologists have to have doctorates. Opticians
Yeah.
have to have a college diploma. Like it's such a broad range of professions. So the college has a lot of stuff to sort through. And so the first thing I always say to people is that there are so many professions in BC that fought really hard for self regulation. And
Yeah.
so self regulation, sometimes practitioners will say to me, well, that's like I regulate myself. I eat when I'm supposed to, and I use the bathroom when I'm like, no.
Yeah.
Self
Great.
regulation in the government's context is when you can actually say, as a profession, the people who are governing us, the people regulating us, the people on that board are physiotherapists. So I'm
The
self
experts in the
regulated
field.
because I'm a physiotherapist who's regulated by physiotherapists. And that's gone now in the province. And I don't know how much people have understood that and the difference that makes, that you're being regulated by people on a board who actually may not know anything about physiotherapy. So
Yes.
I've said we used to have something that you might be familiar with between the Physiotherapy Association, the Physiotherapy College, and the UBC Physiotherapy Program, a triumvirate where they would get together once a year, the two boards and the faculty, and they would have a meeting and they would talk about current issues or something. And that's actually not even possible now. Because what would a college board do sitting down like they're not physiotherapists. They're
Yeah.
not, right? So it's a very different model just from that sense of who's at the college and how does that work? And
Yeah.
how are decisions made about the various professions? Having come from oral health, which amalgamated 2 years ago, I think.
Yeah.
Maybe no, it's four. I was there. So 4 years ago, it's tough if you're not the dominant profession.
Yeah.
So, like, the dentists are basically making the rules for everyone.
Yeah.
And yet that makes the dental hygienists who are autonomous, but it really has sidelined some of the things that they care about. And so that lack of self-regulation is important. And it is something that, I think a lot of times we mourn the loss of. And if you think of how regulation really started, it was probably some small town group of ladies saying physiotherapy who started talking to each other. Oh, you're a physio. I'm a physio. Hey, let's have a chat. Oh, you do this. I do that too. That's great. This. And then someone moved to town and they were like, they do weird stuff. I don't like what they're doing. Like, we
Yeah.
need to make sure that the public and everyone knows they're doing something that we think is off. Right.
Yeah.
And so suddenly you have this group form that becomes the precursor to regulation of the profession, because the profession itself is saying, wait, 10 of us here are like, and that person over there is doing something we don't like. So the 10 of us here are going to say, we actually think there should be a reason why you can't just do that. And so then
Yeah.
that's how regulation starts. And so
Yeah.
now it's very different when you're in a world where you're regulated. And at some point, we won't even have a seat on the board because there's
What?
12 board seats. There's 12 board seats. 6 of them have to be public members appointed by the minister. And that leaves 6 other professions on the board. But we're going to have 10 professions in our college by November. So right now the psychologists aren't on the board. You can imagine how happy that makes them. And so that's going to be hard for people to get used to. And hard for people to get used to that you're not going to have any say in who represents physio on that board. It's up to the minister to say, yeah, that person's good. So that's a complexity that we're still trying to figure out how that's going to work. And we're actually on Friday, the superintendent. So there's a new superintendent that oversees all of the colleges. She's going to come and chat with the association CEOs and EDs about what that nomination for board process looks like,
Okay.
because there has to be enough checks and balances too. That if I know that there's a physiotherapist who's wackadoodle, then I could be like,
No, no.
maybe don't put that person on the board. Yeah. I mean, I can't think of any actual physiotherapists that I would want to blackball. I want to know that as a profession, we have the right to say, whoa,
Yes.
like that is not a good representative of who we are as a profession.
Yeah.
So anyway, so the board nomination process, it is what it is, but that is one that we sort of struggled to figure out. But there's so many nuances in Danielle that, like,
Oh,
you have to be able to practice anti-discrimination, which sounds great.
Yeah.
But how do you do that in your day-to-day life? What does that actually mean in terms of how you practice?
Yeah.
Is it a course that you have to take? Is it a checkbox you tick to say I'm not a racist, which doesn't seem like it would be very helpful?
Yeah.
We just really don't know. And so that whole piece of there's so many questions. And so the college has started consulting on their bylaws, and I did a call out for that, but people were not all that excited about it, which I understand. My staff are thrilled at having to read them. But I kind of wish there was a way to say to people, like, there are things in here that you probably want to read. Some of it's good. The
Yeah.
provisional license is coming back. That's a good thing for
Yeah.
physiotherapy. We're not
Huge.
going to complain about that. But if you read our regulation, I talked about it earlier, there's a whole bunch of stuff there around certified practice and who that applies to. Great. The bylaw comes out for certified practice. I'm like, woohoo, let's see what it says. It doesn't say anything about physiotherapy. And that's not the college's fault. The college had said, don't put it in the reg until we actually have a plan. They have to build a plan, but they also have to write 18 bylaws, and they have to get a
Yeah.
college. Like, they have so much work already that of course they don't have time to sit down and go, okay, we've got certified practice for physios, which means they're going to have to figure out what programs are they going to credit, what is your education level, how many hours. Like, there's a lot to be done to set that in place. So some of that is pretty frustrating. You're just kind of, you're like, this is just, it's going to end up being confusing. I
Yeah.
don't I don't like, I had sort of said, like, are you grandfathering people in? Because some of
Oh,
the certified practice, like, pelvic floor is gonna be certified practice. So are you
yeah.
gonna grandfather all those guys in?
Right.
Probably, but we don't know that yet.
And this is all happening on April 1st.
All happening on April 1st. The disciplinary stuff is something that comes up a lot. What will happen is if there's a investigation, it goes through the college, does the investigation, but then they hand off any disciplinary decision to a different tribunal, which is run out of the
Right.
superintendent's office. And the frustrations around that have been around the fact that your tribunal could consist of a doctor, a licensed practical nurse, and a lab technician.
Right.
So it's just, is it someone who knows your scope or understands,
Yeah.
what
Yeah.
the actual practice is. The penalties can be quite a bit higher, and that's in part why I wrote that blog last week when I was talking about the California clinic where the nurses had clearly done
Yeah.
something they shouldn't have and gone online with it. And if people are interested, they can read that. But it wasn't so much to talk about that as to talk about the standards for behavior and performance are going to
Mhm.
be much higher. And
Yes.
so I understand, I think we all understand that things are said in an office space that you don't mean harm necessarily, but under the new act could actually be considered discriminatory, and you would get a call and put through
Right.
that investigative process. So I don't want to panic everyone, but at the same time, I want to make sure that physiotherapists understand that there's probably going to be a much higher threshold for complaints than there is right now.
Yeah.
And so talk to my staff this all the time, and we'll be coming out with more about this, but physiotherapists are touchy people. That's your job. And I
Mhm.
think sometimes, especially when you've done it for a while, you don't think about how you're touching someone, or how they're reacting to it, or what part of your body might be brushing against them or pressing into them. And it's nothing to the physiotherapist. It's probably nothing even significant,
Yeah. Yeah.
but it can end up in a harassment complaint. There's lots of
Yeah.
questions about the fees that the Health Professions Act enables the colleges to assign. Um, we definitely have some concerns about that as well, because I think there's a sort of a vague area where it can be a $25,000 fee for an individual and 250,000 for a corporation.
Yeah.
And that corporation piece sends most clinical to go, wait, what?
Yeah.
Like, that's a lot of money. So
Yeah.
we're still trying to grapple through what exactly that means. Um, I mean, I could go on and on. There's so much in that HPOA that we're trying to figure out. So we will be doing a webinar in October that will
Good.
be with our lawyer, Sarah Fitzpatrick, who's an expert in this area.
Amazing.
And she will go through the parts of the HPOA that concern her the most in terms of practice, as well as we've had her review the bylaw responses that we've given, just to say, here are things that are flagging to her as being concerning. Um, we still have, there's two bylaws that are up now for final on the 15th, and then there's 2 others. But what we had asked, and I think the college has agreed to, is because there are so many parts of the current bylaws, they've done them in pieces. So we get 4 at a
Mhm.
time or whatever. The
Yeah.
problem is that in a lot of places it's saying, please refer to Schedule X, where there's no Schedule X, or it will be something will be capitalized, which in legal language means there's a definition, but there's no definitions. So what we've said is like at the end of the individual reviews, if they could put it all together, and then we can review the whole thing at once and actually cross-reference. I just did the one on general. It's called general, and I thought, oh, it's only a page. This will be easy. And then I realized it's all about how the college can assign special fees for things that they think. And I'm like, wait a second.
Ugh.
And there's nothing that says special feeds, including or at the limit of or at the maximum of. So there's just still a lot of things that are unclear. And so as we're racing towards April 1st and trying to think, how do we get our members to understand enough so that are their caution flags are raised about certain things, while not panicking people to think, oh my gosh, this is gonna, because I've had those calls from people saying, my ex-husband's telling me that he's gonna wait until the HPOA comes into effect and then he's gonna take the house and the kids and blah 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 blah. And I don't actually think that's possible, but it's being used as a threat in that way.
Whoa.
And there's this idea that people can be sent to jail. And so
Yeah.
we're just trying to get a really good sense of it. The other challenge is that they've taken away the opportunities for certain kinds of reviews, that appeals that you would have had before. And so we're just trying to understand. Unfortunately, what we hear from government most of the time is, well, that will be decided by the courts, which I keep
Oh,
saying, please don't let it be a physiotherapist in that situation.
yeah, and sets
Because it,
that precedent.
yeah, so
Oh.
much of it is that. So I think it will be worthwhile, and I really will suggest and really encourage that when Sarah does come to do a webinar and talk to people, that people listen or come to listen to whatever they can, because it's so daunting to look at the whole thing. And when they deposited the orders in July, so they deposited the date that it would go live plus all of the new regulations so there's one regulation for all health professions, and then there's a regulation for like just the ones in our college. And then there's the restricted activities list. We didn't even notice. I don't think any of the associations even noticed that there were other orders deposited that day that actually take the colleges and make them government reporting entities. And so that
Oh.
means that they're sort of similar to ICBC and WorkSafe, right? And that suddenly member dollars are actually being run through government treasury, and they go to estimates. And yeah, so there's a whole complicated part of that too that we were all like, wait, what happened? So there's still so much to try and understand and wade through. And I keep saying to myself, then I've been looking at this stuff for like 4 years. How the
Yeah.
heck am I going to make it anything that people even can get their heads around in 6 months?
It's so overwhelming.
And it really is overwhelming. And when the associations met for the first time after the orders were all deposited, I think they were deposited on July 17th. So we met like the week after. And I think the first part of it all, we all just sort of sat there going, what do we do with this? Like, how do we even help members understand? And the
Yeah.
colleges, because they're becoming more and more part of the government reporting, which is part of being a government reporting entity. But the colleges are not going to, at least publicly, be able to say they disagree with parts of it, right? That's not going to be their job. So
No.
in that sense, like it's frustrating because I have all the time in the world for our college and for the work that Diane does. And I'm really grateful that she's there. But I also know, first of all, the amount of work they have to do right now is not humanly, I don't think, possible. Like it's unbelievable what they have to get through in the next few months. But also, they have to do it without upsetting government because they're actually part of that government structure now in a way that they weren't before. And so I think sometimes when I talk about it, I think people think that I have animosity towards college. I really don't. It's more about how do we make sure the college is going to do what it has to do legally. And
Yeah.
so one of the best examples of it, when the nurses, and it was quite a while ago that the nurses amalgamated, and they talked all about how it was going to streamline things. It was going to be cheaper. Members would be paying less, all of this great stuff, none of which has turned out to be true. Everybody's membership dollars have gone up. I'll tell
Yeah.
you the naturopaths found out yesterday that they're going up by, I think it was 30%. So they're going to be the most the highest registration dollars of anybody. But when it happened with the nurses and they were going through this process and they kept talking about, you know, it's going to streamline, it will be cheaper, it will be this, ends up being that regulation is really expensive. And so it ended up costing everyone more. And I know that physiotherapists all went, wait, our fees just went up last year. But let me tell you, physiotherapists and occupational therapists, I think, are the lowest fees
Yeah.
in the province. So expect that to change. It becomes this it becomes this hard process of the college is doing everything they have to do legally to do what they have to do. And they are not there to protect you. They're not.
No,
So
the
I remember
public.
when I was still with nursing, we had written a letter from the association, the union, and the college asking for the chief nursing officer position to be reestablished in government. And we all got answers, and it was basically to the association, no, and to the union, no, and to the college, that's advocacy. You can't do that. Yeah. So they're serious about this. They cannot advocate on behalf of the profession.
The profession.
That's not their job. And so
Wow.
yeah, and so unfortunately, that makes people feel like the college is out there to get them, and that's not true either. I mean, the college really is just trying to make sure that there's safety for the public and that,
Yeah.
people are practicing appropriately. But it's a hard thing pill for people to swallow because they think, well, the college is just there to be the police. They're really not. They're really not. They've sort of been thrust into that unfortunate role, but they do
Mhm.
amazing work around standards and helping people understand, what the scope is, and they will be the ones that interpret the scope. They will be the ones that set up the certified practice and who are really looking at all those things. So, I mean, so grateful for that. But
Yeah.
I guess what I'm saying is that there has to be that recognition that it's not against the college thing when we speak out and say this is terrifying and it's moving far too fast, which I think is our biggest message. Like, why do you have to do this so quickly?
Yeah.
Maybe enact little pieces of it at a time so people can get their heads around it. So
Yeah.
one of the things we're going to do this fall is a campaign that all of our professions will be in, not just physio, which is really going to be a suggestion that people talk to their MLAs and say to them, you're freaking us all out. Can you
Yeah.
just not
Pump the brakes.
slow this down a bit, give us time to digest, maybe implement the parts of it that we understand make sense, but maybe slow down a little bit on some of these other things until they've been better explained and there's clarity. Because I
Yeah.
don't know how on April 1st you say to someone, have you been practicing anti-discrimination? And you'd be like, how exactly do I do that? Because I don't know the
Yeah.
answer.
Yeah. Exactly. And the more you have to work through, the more overwhelming it becomes and the less people do. It's the same with
Yeah. Oh,
exercise.
yeah.
Like I try to prescribe 1 or 2 exercises that I know someone will do versus giving them 10 or 12 that they're going to look at and be like, I don't have time for this and walk away. It's the same thing with this legislation. Like I can digest 1 or 2 sections, the whole thing, forget it.
I have to sometimes like physically force myself to sit and read it because it's massive and it's so complicated. It's so overwhelming. And I've been in the middle of this mess for 4 years. And so I just
And
can't even imagine picking it up today and being like, "What is
yeah,
happening? What is going on?"
exactly.
I
You
haven't
have
even
experience reading this type of stuff and like
I have a lot of connections still within government, within the various colleges, not just ours, um, who are pretty good about sharing unfiltered views of what they think. And that's really helpful because it gives us sometimes, you know, places to look at, like
Mhm.
government reporting entities. I hadn't even looked at that. And then somebody sort of who was in the know was like, you might want to check into this because the minister
Yeah.
actually legally is obligated to make a public announcement when he does that. And he has not. Um, so I think that there's strength in the number of us that are all sitting, putting our heads together, being confused by it.
Yeah.
And it's all the associations. We went in on a legal opinion with the doctors, the nurses, the chiros, the massage therapist, the dentist, the optometrist.
Wow.
And we shared a legal opinion just on the whole HPOA and what it looks like. And while we
Wow.
can't share the legal opinion, it's given us a lot of fodder. And
Mm.
Sean has built some GPTs around it. So
Yeah.
even when I'm doing the bylaws, he's done one on the bylaws. That one's not public, but I can say what are the differences between the new bylaws coming for pharmacy, our college, the small college, and it
Right.
will actually spit out these are the things that are different and might be concerning. But for the HPOA, it's a really good place to go and say, okay, what does anti-discrimination mean? what does it
Right.
look like to this? And it'll say, well, they haven't really told us yet. So
Wow.
yeah.
Yeah, to be honest, I've used ChatGPT to help break it down. I keep putting the bylaws in there and being like, "Can you explain this in lay terms and tell me what things I should be concerned about?" That's my prompt, and it's
Because it's,
great.
I mean, even the bylaws are written in language that's tough, right? And
Yeah.
I can't imagine. I mean, I've read a billion bylaws in my life. I can't imagine if I didn't have that background, not just thinking, I'm not doing this. I don't care.
Yeah.
And so, but
It's
by not caring, we end up in this place where we can't.
yeah. Yeah, exactly. We have to care. We have to.
We
We
have to.
have to. We
Well, I
have
have
to,
to
and I
care. So I have to try and make as many people as I can care too. But my hope is that we can have physiotherapists who are interested in going and talking to their MLA
Yeah,
just to say slow down the HPOA and also MSP rates are you should be embarrassed, which is what I said to the finance committee. You should be embarrassed. It's
they
been
should.
24 years. You know,
Yes.
nobody gets
It's
$23. It's not pretty soon minimum wage
100%.
is going to outpace what MSP will pay, which would actually be kind of funny.
Oh
Like,
my god. Yeah. Yeah, exactly. Well, I mean, this has been amazing, and I really, as much as this is a really, like, I'm not gonna call it scary, but overwhelming process learning about HPOA and what's coming down the pipeline, I am so grateful for the legwork that you and the team are doing because I don't even think alarm bells would have been raised at all if it wasn't for you guys. Like, it would have, I don't even know how we would have found out about it. And I mean, like, who knows what the alternative would have been, but honestly, I feel so much more supported, and I feel like I have a better understanding of what is happening to the profession and within the profession as a whole because your communication and transparency has been so, so epic and amazing. And I just am very, very grateful for you, your leadership, and the team over there because I think the profession is so well supported right now.
yeah, well, we're going to continue to do our best. I'm so proud of the team that we have here. I
Yeah.
think this is a great group of people, and everybody is really focused on what the best thing is for the profession and how we achieve that. So I'm appreciative of any group of people that's willing to be all hands on deck and just do what needs to be done and roll up their sleeves and make it happen.
Yeah.
So
Yeah.
that's awesome. And the skill sets are also different too, which is great. So
Yeah.
as we move, like we're just about to sort of announce the stronger member supports for people so that they can call and Patrick can provide advice on things because we know that um no, not it's not the college's fault. It's not questions that they would normally answer, but they just have not really had a home to ask some of the things that people are like, this just happened to me. What do I do? So that as we bulk that up, Jason is a rock star. And so he's really
Yeah.
getting interested in the advocacy piece, which is great because I need that support person that I can help help teach how to move through all of these circles and get stuff done. Tina is our new director of operations, and she ran a clinic for 8 years. So man, she knows what she's talking about,
Yeah.
and she's good because maybe I'm not of all of the skills I bring. Organization is probably not my top one. Brain goes like this. Everybody's always like, "How many balls do you have in the air?" I'm like, I don't know. I mean, she's
All of
probably
them.
so she's been awesome. And of course Sean is solid.
Yeah.
And we have Eric who came in March and is doing the comms piece. So
Yeah.
every newsletter is him that's landing that and taking on a lot more of the strategic stuff. So I'm really grateful for who we have here. We have a new employee too who's doing the financial stuff, which
Oh,
another
nice.
area that is not my favorite
Yeah.
to do.
Yeah, mine either. Mine either.
So I
Mine
think we're
either.
well positioned. I think the board is great here. It's one of the better boards I've worked with in terms of their understanding of their role and not um, stepping into operations, but also
Mm,
being invested in and caring about what's happening here and setting really clear strategic plans that we can actually look at and that makes sense.
yeah.
So yeah, I mean, I love it here. I'm really happy that I came to this spot and I'm not leaving
Yeah.
anytime soon. You have to drag me away
Well,
here.
I'm very happy to hear that piece, and likewise, we're very happy to have you at the helm, so thank you, Andrea. Honestly, great chat. Anything else you wanna share or, like, any last pieces you wanna throw out there before we wrap up?
Yeah, I think that the only last thing I would mention is that you all got a survey from government. I'm going to say you got it from the college, but it's a government survey. It's not a college survey. The college is not defining you as allied health professionals. It's government that wants that definition. If you
Mm.
haven't filled it out, please go and do so. You can read my blog and you'll understand immediately that I'm not fond of the definition. I don't like the lumping together with 70 others. We do have some strategic ideas around how to change that. So we'll be working on that with some of our partners who are, I think, in a similar position like OT and Chiro and
Yeah.
optometry and so on. But please go do and fill that out. But please, I mean, I've had quite a few people say, "Why is the college doing this?" And I'm like, "It's not the college." But please don't attribute that to the college. It's a group out of the ministry called the Allied Health Policy Secretariat. Have so much time for the work they do, but their mandate is very strange because even though they're in charge of all health, allied health, they only really have a mandate around public. And so
Right.
that means that 70% of our members just got whacked of the information that they're sharing. And so we know we need to do some work on that, but please do fill in the survey because I don't ever expect to say to someone, "Oh, what do you do for a living?" and have them say, "I'm an allied health provider," if they're a physiotherapist. I want to know your physio
Right.
as you worked hard to
Yeah.
become that. So be proud of it.
Exactly. Exactly. Well, thank you. And I really want everyone who is going through renewal to renew their PABC memberships. And if they're not a member, become one.
Yes,
Like,
please do. I mean, we are now, and this is not a slur on the college, we are the only organization in the province that speaks only for physio. So the college
yeah,
has 10 professions soon, 9 right now, soon to be 10, and they don't speak on behalf of you because they're not allowed to. So if you believe that the work that we're doing is great, and man, public practice people, in case you didn't know, you get a discount on your insurance. So you get a discount on your membership if you are a CPA, PABC member. And I know you'll say you get insurance through the health authorities, but really look very carefully at what that insurance looks like because it's not the same.
yeah,
And I would love to do more with our public practice folks, and I'm
yeah.
reaching out to them to say like where are the areas we can advocate for. And I know the contract is one, but we can do more, and we will do more. So yeah, join us. If you don't like it after 8 years, then you can tell me so.
But don't knock it till you try it.
Which sounds like Victoria, who called me, I don't know, probably 2 months after I started. He's like, "I don't know why I would belong. You guys don't do anything for me, blah, 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 blah." And now he's like our staunch supporter and participant in stuff. And I value his opinion over so many opinions. So you never know, you might join and then be like, "Oh,
Yes, yes. Oh, yeah. Great guy.
yes, yeah, he is."
Great guy. Amazing, Andrea. Thank you so much. Enjoy the rest of your afternoon. And
Thank you.
yeah, maybe we'll do it again once we get some more updates and clarity around HPOA and WorkSafe and some more updates. But we'll save the juicy stuff for when we get some more wins out of these
Awesome.
contracts.
You know where I am anytime.
Amazing.
And
Thanks,
everybody out
Andrea.
there has my phone number. So it's my
Yeah,
personal cell. So you can call it anytime.
I love it. Thank you.
Thanks. Thanks, Danielle.
That's it for this episode of The Health of Business. If you're navigating any of these challenges in your own clinic, know that you're not alone. If you're interested in working together on any of these challenges in your business, head to danielleboyd.ca to learn more about my consulting offerings and to get in touch. Catch you next time on The Health of Business.